the individual mandate and the penalty associated with it is an onerous burden placed on your lowest income earners. As an example, 80% of those who pay the penalty of the individual mandate live in a household of $50,000 or less. 34% of those who pay the penalty live in a household with an income of around $25,000. The good news is when Republicans said, if you like your insurance, you can keep it, we actually meant it. When you eliminate the individual mandate, if you're getting a subsidy today, you get a subsidy tomorrow. If you like your insurance, you stay on the exact same policy. Nothing changes when we remove the individual mandate, except people then decide whether they want to buy it or not. It's that simple.
Senator Sanders?
It's not quite that simple, Tim.
Please tell us.
Because if somebody decides they don't want health insurance, which is their right, and they come down with cancer, and they run up a medical bill of several $100,000, you pay it, I pay it, and everybody else in this country that has health insurance pays it. Now, I happen to think that the individual mandate is not the best way. But I believe that we should do, as I mentioned earlier, guarantee health care to all people. You are saying if people don't want health insurance, hey, no problem. They don't have to have it. And then they go bankrupt or somebody else picks up the bill for them. The obvious solution to this problem is, again, to do what every other country does. Say that health care is a right of all people and end the absurdity of the United States of America being the only country in the world not to guarantee health care to all people.
Bernie?
That's how you solve that problem.
I apologize for not using up all of my time. I didn't realize you had so much of it. So let me just say this, because the reality of it is that we all pay for our health care costs. There's no change in that. The only question really is how we pay for it. When you buy Obamacare, you thought you were going to be paying around $900 billion. 2 years later, they said it was $1.8 trillion. And now they say they're not quite sure exactly how much it's going to cost. The reality of it is, whether you have the health insurance or not, the disproportionate burden of paying for health care today lies on the shoulders and the backs of working Americans through higher taxes. So the truth is that with or without the plan, someone's going to pay for it, and it's the same person. It is, in fact, the taxpayer. When we give Americans the choice that they deserve, and as you said, it is their right to choose or not to choose to have health care, we want to make sure that we codify that and eliminate, if you decide that you can't afford the premium or you don't want the premium, that you actually have the benefit of not paying a penalty for not having something, as opposed to buying something and not really wanting it.
Well, Tim, here's the problem. What you didn't deal with is the fact that here in America, as you probably know, we spend twice as much per capita on health care as any other major country on earth. We're spending $10,000 per person. In Canada and Europe, where the quality of care is as good or better than what we have, they're spending $5,000. And the reason is that we have an incredibly bureaucratic, wasteful, dysfunctional healthcare system. So I hope that you would work with me to lower the cost of healthcare in America and guarantee healthcare for all people.
Bernie, you and I actually agree on this point, by the way, that we do have a bureaucratic, wasteful healthcare system. It's called the ACA.
Senator Cruz?